Seeing the words abnormal ECG T wave on a report can feel instantly jarring. It's a technical term that sounds serious, and it's easy to feel anxious or uncertain. An abnormal ECG T wave is a change in the final part of your heart's electrical signal. This part of the ECG represents the heart muscle recharging between beats. While it can be a sign of a heart condition, it often has many other, less serious causes. A single ECG finding is not a diagnosis. It's a signal that may warrant further investigation. Think of your heart's electrical rhythm as a short piece of music that repeats with every beat. Each part of the ECG tells a story about what your heart is doing at that moment. The T wave is the final note, showing that your heart's main pumping chambers, called the ventricles, are resting and resetting for the next beat. A normal T wave is typically upright in most ECG leads, smooth in appearance, and slightly asymmetrical. It usually rises gradually and then returns to baseline. An abnormal T wave is a signal, not an immediate verdict. It simply means the shape, size, or direction of this recharging wave is different from what is considered typical. Different does not always mean dangerous. Many things can influence the appearance of the T wave, and context is essential. An isolated abnormal T wave without symptoms often leads to follow-up evaluation rather than an emergency response. The T wave matters because it provides a window into your heart's electrical stability and the health of the heart muscle. A consistent, well-formed T wave suggests the recharging process is happening smoothly. A change may indicate that something is affecting that process. Understanding this finding can be reassuring for several reasons. First, it is a clue rather than a conclusion. Second, many causes are benign. Stress, intense exercise, dehydration, and electrolyte changes can all temporarily affect the T wave. Third, understanding the finding can help you have a more informed conversation with your healthcare team. The T wave represents a process called ventricular repolarization. After every heartbeat, the heart's main pumping chambers must reset electrically before they can contract again. Imagine an old camera with a flash. You press the button and release a burst of energy. Then the flash must recharge before it can fire again. The T wave represents that recharging phase. It is quieter and less dramatic than the main electrical spike of the heartbeat, but it is equally important. A healthy, upright T wave suggests that the reset process is occurring smoothly and efficiently. It reflects electrical stability and readiness for the next beat. Doctors pay close attention to the T wave because the recharging phase is sensitive to many conditions inside the body. Oxygen levels can affect it. If heart tissue is not receiving enough oxygen-rich blood, the recharging process can be disrupted. Electrolyte balance can affect it as well. Minerals such as potassium, calcium, and magnesium are essential for the heart's electrical activity. Changes in these levels can alter ventricular repolarization and produce T wave abnormalities. The physical health of the heart muscle also matters. Structural changes in the heart can influence how electrical signals travel and recover after each beat. Because this phase is so sensitive, an abnormal T wave often acts as an early warning sign. It does not automatically mean something is seriously wrong, but it may indicate the need for a closer look. Not all abnormal T waves look the same. Different patterns can provide different clues about what may be affecting the heart. One common finding is T wave inversion. Instead of curving upward after the main QRS complex, the T wave points downward. For some people, an inverted T wave can be a completely normal finding in certain ECG leads. In other situations, a newly inverted T wave may suggest reduced blood flow to part of the heart muscle, a condition known as myocardial ischemia. The location of the inversion matters. Doctors often compare a new ECG with prior recordings to determine whether the finding is long-standing or new. A long-term Finnish study involving more than 6,300 people found that T wave inversions in specific regions of the heart were associated with a higher risk of coronary heart disease. Findings such as these help clinicians use the location of T-wave abnormalities as important diagnostic clues. Another pattern is a flattened T-wave. Instead of forming a gentle hill, the wave appears smaller and less distinct. Flattened T-waves are often associated with electrolyte imbalances, particularly low potassium levels, known as hypokalemia. Potassium plays a critical role in the heart's electrical activity. When potassium levels fall, the recharging signal can become weaker and less pronounced. Dehydration. Certain medications, such as diuretics, and some medical conditions, can contribute to low potassium levels. A flattened T-wave often points toward a systemic issue, such as an electrolyte imbalance, rather than a primary problem with the heart muscle itself. Another pattern is a peaked T-wave. In this case, the T-wave becomes unusually tall and prominent. Narrow, pointed, or tented T-waves are classically associated with high potassium levels, known as hyperkalemia. Excess potassium can make the electrical signal overly strong and sharp. Hyperkalemia is a potentially serious condition that requires prompt medical attention because it can interfere with the heart's rhythm. Clinicians may also look for hyperacute T-waves, a related but distinct pattern that can appear during the very early stages of a heart attack, sometimes before other ECG changes become apparent. For that reason, prominent T-wave abnormalities are evaluated carefully in the appropriate clinical context. In summary, inverted T-waves may be normal in some people, but can also suggest reduced blood flow to the heart. Flattened T-waves are commonly associated with low potassium and other electrolyte disturbances. Peaked T-waves may indicate high potassium levels, while hyperacute T-waves may appear in some circumstances during the early stages of a heart attack. An abnormal T-wave can arise from many different causes, and many of them are not related to a serious heart condition. When doctors evaluate T-wave changes, they often begin by considering heart-related causes. One possibility is myocardial ischemia, or reduced blood flow to the heart muscle. When heart cells receive insufficient oxygen, the repolarization process can be altered. Another possibility is pericarditis, an inflammation of the sac surrounding the heart. This inflammation can affect the heart's electrical signals and produce widespread ECG changes, including T-wave abnormalities. Cardiomyopathies, which are diseases of the heart muscle itself, may also change the appearance of the T-wave. When the heart's structure changes, its electrical behavior often changes as well. A previous heart attack can leave scar tissue behind. That scar tissue may produce persistent T-wave abnormalities on later ECGs. It is important to remember that these are possibilities, not conclusions. An abnormal T-wave does not automatically mean that any of these conditions are present. Electrolyte abnormalities are among the most common explanations for T-wave changes. The heart's electrical system is highly sensitive to changes in potassium, calcium, and magnesium levels. Even relatively small shifts can produce noticeable ECG T changes. Low potassium levels may flatten the T-wave. High potassium levels may produce tall, peaked T-waves. Because of this strong relationship, checking electrolyte levels is often one of the first steps in evaluating an abnormal T-wave. Many non-cardiac factors can also affect the T-wave. Intense exercise can temporarily alter the heart's electrical activity. In some athletes, T-wave inversions may appear after strenuous activity and then resolve during recovery. Stress and anxiety can also play a role. Elevated levels of stress hormones, including adrenaline, can influence heart rhythm and electrical signaling, leading to temporary ECG changes. Certain medications may affect the heart's repolarization process. These include some antidepressants, antipsychotic medications, and certain antibiotics. Neurological conditions can also influence ECG findings. Events such as stroke or severe head injury may produce striking T-wave abnormalities, including deep inversions. Understanding this broad range of potential causes helps place the finding in perspective. An abnormal T wave is a clue that requires interpretation within the larger context of a person's health. An abnormal T wave is not a diagnosis. Instead, it is often viewed as a risk marker or an early signal that additional evaluation may be helpful. Your healthcare provider may recommend blood tests, an echocardiogram, a stress test, or other studies to determine what is causing the change. This proactive approach can create opportunities for early intervention. Depending on the cause, that may involve lifestyle modifications, medication adjustments, treatment of an underlying condition, or ongoing monitoring. Although many T-wave abnormalities are harmless, clinicians take them seriously because they can occasionally be the first sign of a more significant issue. Research has shown that T-wave abnormalities can be associated with an increased risk of sudden cardiac death. Sudden cardiac death accounts for approximately half of all cardiovascular deaths worldwide. Studies have found that even relatively minor T-wave abnormalities may be linked to increased risk and lower long-term survival in some populations. That does not mean an abnormal T-wave predicts a dangerous outcome. Rather, it highlights why healthcare professionals pay attention to these findings and investigate them carefully. The most important next step after seeing an abnormal T-wave is usually a thoughtful conversation with your doctor. An ECG provides only a snapshot in time. The finding must be interpreted alongside your symptoms, medical history, medications, physical examination, and any previous ECGs. Certain symptoms deserve immediate medical attention when they occur alongside an abnormal ECG finding. These include new chest pain or chest discomfort, new or worsening shortness of breath, dizziness, lightheadedness, fainting, or new and significant palpitations that feel different from your usual experience. These symptoms do not automatically indicate a serious problem, but they warrant prompt evaluation. Preparing for a medical appointment can help make the discussion more productive. Consider bringing a list of your symptoms, including when they occur and what you were doing at the time. Bring an updated list of medications, supplements, and over-the-counter products. It can also be helpful to prepare questions about possible causes and recommended next steps. Several common questions arise when people learn they have an abnormal T-wave. Can anxiety or stress cause T-wave abnormalities? Yes. Stress and anxiety can affect the autonomic nervous system and trigger the release of hormones such as adrenaline. These changes can temporarily alter ECG patterns, including the appearance of the T-wave. Is an inverted T-wave always a sign of a heart attack? No. While T-wave inversion can be associated with reduced blood flow to the heart, it also has many other causes. In some people, it is simply a normal variant. Other potential causes include inflammation of the heart, electrolyte imbalances, and a variety of non-cardiac conditions. Can an abnormal T-wave return to normal? In many cases, yes. Whether a T-wave abnormality resolves depends on its underlying cause. If the change is related to a temporary or treatable issue, such as dehydration, an electrolyte imbalance, medication effects, or stress, the T-wave may return to a normal appearance once the underlying issue is addressed. Ultimately, an abnormal ECG T wave is best viewed as a signal rather than a verdict. It is information that can help guide further evaluation, support informed discussions with your healthcare team, and encourage proactive attention to heart health.